discuss why political action matters for the longevity community and what A4LI plans to do to help foster the creation and equitable distribution of longevity therapies in the US. So first, let's discuss why the longevity community needs political advocacy. I come across a few people every so often who take the attitude of, why do we need to do this for longevity at all? Why can't the private sector take care of it? So to all those types, here's why the government needs to be involved. First, there are major roadblocks in policy, and policy affects the private sector. So if we want the private sector to take care of this issue, we need to at least remove these roadblocks. The two big government roadblocks, though, are a lack of foundational funding for longevity and geroscience, and a lack of clinical pathway in the FDA. There's also a tremendous lack of public awareness, which it kind of extends to our policymakers. Voters don't really know about these issues and don't really demand action on it because of that. The lack of general awareness on this issue will ultimately be a detriment to the biotechs looking to create these drugs that target aging and therapies that target aging. If the public doesn't know or care about this, right, who do you plan on selling it to, and why bother creating them at all? I also personally feel that in order for this industry to mature, it needs to have a political advocacy effort and government assistance. And by mature, I mean going from a fringe issue to more of a mainstream issue. Pretty much every established issue space that you can think of has political advocacy efforts that they're part of. And it seems standard in all the industries that really affect our lives today. So if we want longevity to be held on the same level as climate change or I don't know, gun rights or whatever it may be, we need to do the same things that those industries do, which is be politically active. So the question now is, why bother explaining the importance of political advocacy? Well, to show why A4LI's mission is so important. Just another refresher, A4LI is a DC-based nonprofit and is the first 501c4 nonprofit in the longevity space. Our C4 designation allows us to act politically, something that the other nonprofits in the space aren't really allowed to do, being C3s. We're able to lobby policymakers, create and promote legislation, advocate for policies, all in the effort to help move the longevity industry forward. But we also seek to educate these policymakers and the voting public in general on the potential of longevity and aging therapies. Now let's get into A4LI and what the main initiatives are. Our first and only focus right now is forming a longevity caucus in the House of Representatives. From there, we will launch our other initiatives, which include increasing funding for the geroscience arm of the NIA, reforming the FDA to make it easier for longevity companies to get their drugs passed, reforming ARPA-H, which is a newly minted DARPA twin. And the goal there is to get longevity-focused program managers in ARPA-H. And then also we're looking for the CBO to fund a study on the longevity dividend to further give them a reason to push for this. And then also we'd like to see the US government set a national average lifespan goal, healthy lifespan goal. So the longevity caucus, why is this our main initiative right now? Why are we only focusing on this? Well, because before we push for any actual legislation, an increase in funding or working with the FDA, we need political support and the willpower to get this done. A caucus, I'm sure many of you may know, but a caucus is a group of members in Congress who, share an interest in a topic, and want to advance the issue. Obviously, in this case, that's longevity biotech. But it really doesn't make much sense to push for anything without having this kind of backing in Congress. The makeup of the caucus will be, completely bipartisan. Now, why is that? Two reasons. The first reason is, everybody ages, whether you are on the left or the right, you are going to age and get sick. And, it doesn't matter what political party, belong to, everybody wants to stay healthier and, feel better for longer, right? So this issue doesn't discriminate. But also, from a strategic standpoint, A4LI doesn't want to be shut out. Longevity, we don't want the longevity interest to be shut out based on the political cycle. So, every 2 years there's a midterm or a presidential, right? And the House and Senate get completely reshaped. And so we don't want to kind of be just standing around and not being able to do much because we've only been working with one party. At this point in time, we have one commitment from Congressman Paul Tonko from New York's 20th District, upstate New York. He is from the Capital District, and he's in general an ardent supporter of advancing scientific discovery. So, I knew reaching out to him that longevity would be right up his alley. You may have actually seen some public events that we've done over the past few months with the congressman. Our goal, though, is to get 2 Democrats and 2 Republicans to co-chair this caucus. And we actually have a bunch of we're involved in a bunch of conversations that I won't mention any names yet, but stay tuned because we should have an announcement on who the co-chairs will be sometime by the end of this year. The NIA Division of Aging Biology. Now, there's a running joke in the longevity community that I've heard many times that the NIA might as well stand for the National Institute on Alzheimer's because a significant portion of their budget goes to Alzheimer's research. My grandmother passed away a few years ago from Alzheimer's, so I have seen firsthand how absolutely devastating the disease can be. So don't get me wrong, I want to cure Alzheimer's disease, but the allocation of funds is just off, especially considering the potential for geroscience to treat Alzheimer's disease and the other diseases of old age, right? So there needs to be a reallocation. Our goal is to get the NIA Division of Aging Biology budget up to at least $1 billion by 2025. Frankly, we would like this number to be higher, but $1 billion is about a 2.5x increase in just a few years, so that would be really great progress. The way we would get this done is by working with the Appropriations Committee to include funding language in the next bill, or we can propose legislation, right, and include funding in the legislation. So stay tuned on which route we're going to take. Probably both. The FDA. So the FDA is a point of contention in the community with some people in the camp of being FDA needs to declare aging a disease today, and there's others who are not so on board with that, who maybe consider aging as the driver of diseases, right? We at A4LI, we're not pushing for this aging as a disease shift in the FDA at this time. Here's why. First, it doesn't seem that the biomarker issue is solved, and every time I've heard an FDA official discuss making aging as a disease, that's kind of the main concern there. We also don't want to pull the rug out from under, I don't know how many longevity companies there are. It seems like there's more every day, but the 150 longevity companies in America, we don't want to pull the rug out from under them and, completely, get rid of the guidelines that they were operating under for the last, decade, right? But third, and probably the most important reason is, we, A4LI, we're a brand new organization, and longevity political advocacy is, kind of a new concept. So, the FDA is a pretty rigid institution, and we want to build a bit of a track record of success before we come to them with such a large demand. Our solution, though, is to create a pathway that is similar to the regenerative medicine advanced therapy pathway, where longevity biotechs can apply and receive things like fast track and breakthrough status. Under this pathway, the FDA will, judge these companies based on 2 things: their ability to cure the indication that they're going after, and 2, the off-label ability to, treat aging and affect the aging process. This solution provides a viable and in the near term, more realistic path to actually help the longevity companies out there today. ARPA-H is something that some of you may not know of yet because it's still sort of under development and still in the process of being established, but I'm sure all of you are familiar with ARPA-H's twin, which is DARPA, right? The agency that ARPA-H is modeled after is DARPA. ARPA-H, in my opinion, is President Biden's flagship healthcare initiative. And, it really has the potential to be transformative, right? We know how, DARPA gave us the internet, right? So, we know that the program structure of being decentralized works. If you go to ARPA-H, the website for ARPA-H on the government website, I'm paraphrasing here, but if you look up the mission, it's to fund the highest risk, highest reward biomedical research endeavors. And my assumption to President Biden is that will mean cancer moonshots. His son Bo died of cancer in 2015, and I'm not saying that cancer shouldn't be a focus of ARPA-H, but based on the definition, longevity needs to be included. There are going to be 100 or so program managers. There needs to be some number of them that are focused on longevity projects. Longevity biotech completely fits the bill in the definition of the type of science that should be explored in ARPA-H. So we will be pushing for that hard. The CBO. So one of the biggest motivating factors that we've found to get Congress people interested is the economic reward that's waiting on the other side of this longevity effort. I'm sure all of you know the longevity dividend argument. Adding one extra year of healthy life expectancy, boosts the GDP of a population. There are, studies that have come out that say it's, a couple trillion. To the most recent iteration was 37 trillion, right? So, regardless of what the number is, it's in the trillions, and it's worthwhile to pursue. But we want the government to produce their own studies so they have their own statistics and their own confidence that this is something worth pursuing. So we want to also set a time-bound goal for increasing life expectancy. And we got this idea from the US's, I guess, parent country, UK. In some respects, the UK is, kind of leading the world in the government being involved in this longevity effort. In 2019, the All-Party Parliamentary Group for Longevity was founded in the UK, which basically acts the same way as a caucus would, but in the UK. And one of the initiatives that they pushed for was a time-bound national goal for healthy life expectancy. They want to add, I think, 5 years by 2035 of healthy life expectancy to their population. So we would like the US government to make a similar declaration. And A4LI and other advocates can use that declaration by the government to keep them accountable on their promise. So more generally, though, A4LI supports, initiatives that will increase drug discovery speed. This can look anything like, increasing the budget of the FDA to hire more reviewers, or things like getting the government to invest in, advanced organ on a chip tech so we can move drug discovery speeds up faster, right? We will always support an initiative that gets better medicine into the hands of patients faster. So it's important to mention, though, I've gone through our initiatives, but I kind of want to talk about some potential pitfalls. Maybe it's important to mention that this political effort is not going to be a cakewalk. Politics are hard, especially with the world we're living in now. So here's just some things to consider when thinking about this political advocacy effort for longevity. One, there are a lot of other important problems in the world. And, I wouldn't be sitting here talking about longevity if I didn't believe it was the most important problem in the world. And I'm sure all of you out there wouldn't be, listening in if you didn't agree, right? But, to a politician who is, just hearing about longevity for the first time, they might disagree. So, it's going to be an effort on our end to find the right people. The other thing is that, there's a lot of hot button political issues that kind of randomly sprout up, like, who would have thought that Roe v. Wade would be overturned? But, that in of itself pushed back the, efforts by a little bit, so you have to be aware of, what else is happening in Washington. On that same note, we need to be cognizant of the fact that political cycles and elections exist, right? Some of the DC people that I've come across consider election season, they call it silly season because everything is just a mess. Nobody really gets stuff done, and everybody's focused on campaigning, right? But basically, that really kind of gives A4LI and other advocates like a year and a half after major elections to get stuff done. Obviously, like the reconciliation bill got passed this past week, so. Things can happen during silly season, right? But I don't think you really see bipartisan initiatives, take shape in the second half of a midterm election cycle, right? So the window for doing things is a little smaller than you might think. And then I guess the last thing is, we need to be aware of the fact that longevity will become more divisive. that's just going to happen, with, it getting out into the mainstream more. The left and the right have their preconceived arguments of why, not to pursue longevity therapies, right? I think they're weak, but that's another debate. Unfortunately, this is going to happen no matter what, as the masses become more aware. And the way around this is by actively making this a bipartisan initiative, which I'm happy to say we're doing. But B, we need to really push the education aspect of this. Explain to policymakers and the voting public why longevity therapies are feasible and worthwhile to pursue. So before I open it up for questions in a little bit, I'd like to just touch on how each of you can get involved and help move this political initiative forward. Obviously, there's the financial aspect of this. The fact of the matter of this world is, money talks, right? People listen to those with money. It's why pharma and the NRA are both so powerful. They raise hundreds and hundreds of millions of dollars a year, right? We don't expect A4LI to necessarily reach those numbers in the foreseeable future. Maybe I don't know, maybe, but who knows? But until that day, until we are raising hundreds of millions of dollars a day, every dollar that the base of this community can, help us with, is really important. Every dollar actually matters a lot more than you think. So I'm asking everybody who's watching this right now to make A4LI and longevity the political initiative you support going forward, whether it's a couple dollars or more, whatever amount you can contribute is helpful. The other way to make a difference, and this is going to be relevant for the near future, is by joining our mailing and volunteer list. As a smaller political organization and a smaller political advocacy effort, it's important that we're very strategic and smart about outreach, who, what, where, when, why. The more coordinated an effort is, the more likely we're going to be successful. As a volunteer, though, you will be tasked with things like reaching out to your congressperson about the longevity caucus, writing letters, things that seem small but actually add up a lot, when we get a bunch of people doing them. So I just want to leave this with the audience. The longevity community must remember that politicians work for us, right? They work for the citizens and their constituents, and they're inclined to listen to the people who keep them employed. So political advocacy and outreach really truly do matter, and I'm encouraging you all to get involved. So I think that's it for me for now. If you'd like to get involved, please visit us at a4li.org. If you have any thoughts on the initiatives we're pushing, or want to get involved further, you can email us at info@a4li.org. And you definitely should give us a follow on LinkedIn, Twitter, and Facebook. Social media is very important these days, so go give us a follow if you can.